Do you have an upcoming OSCE? The Objective Structured Clinical Examinations, or OSCE, are designed to test the clinical skills and professional competencies of future medical professionals. They're practical, real-world exams that are meant to go beyond your theoretical knowledge. So in this video, you'll learn crucial OSCE study strategies and how to prepare for your upcoming exam. Hi, my name is Joseph Kafka, and I'm an admissions associate here at BeMo. Before we get started, be sure to subscribe on whatever social media channel you're watching this from so you don't miss out on any of our upcoming videos. If you would like us to help you prepare for your OSCE, click on the link either above or below this video to schedule your free initial consultation. As a quick tip, check out the timestamps in the description of this video to navigate to specific sections of the video you're interested in. Here's everything we're going to cover on how to prepare for your objective structured clinical examinations. What is the OSCE? The OSCE format, OSCE stations descriptions, what OSCE stations may include, OSCE study strategies, how to create an OSCE study plan, OSCE examination taking strategies, and what not to do during the exam. Let's get started. Typically, an OSCE is not a standalone examination. It's often incorporated into other medical examinations, such as the National Assessment Collaboration, NAC examination, the Medical Council of Canada Qualifying Examination, MCCQE Part 2, and the United States Medical Licensing Examination Step 2 Clinical Skills, US MLE Step 2 CS. OSCEs can also be used in undergraduate, postgraduate, and licensing examinations. The exam is made up of several stations that each candidate has to go through individually. Every participant experiences the same patient problem and is asked to perform the same task within the same time frame. The stations represent real-life clinical situations, so they're designed to assess your ability to apply clinical knowledge when meeting a patient, writing an admission or discharge order, conferring with a colleague, and more. You'll rotate through a series of time stations that represent specific clinical scenarios. Each station will examine your ability in one or more areas of clinical competence. Each station will be the same level of difficulty no matter where you take the exam. And each station will be marked using the same marking scheme. At its core, OSCEs will test your readiness for the practical aspects of the medical profession that cannot be examined using theoretical or written examinations. Your ability to take patient histories, communication skills, physical examination techniques, professionalism, and your ability to effectively interact with patients and other healthcare workers. This is why practical clinical exams are vital. Remember the core competencies outlined by the AAMC when you're preparing for your OSCE. If you're trying to become a physician in Canada, you should review the CanMEDS framework, which outlines the important roles of a physician in Canada: medical expert, communicator, collaborator, leader, health advocate, scholar, and professional. While all these competencies and roles greatly depend on your theoretical knowledge of the medical sciences, they all require a practical approach and suitability. The OSCE will assess your practical competencies in these areas. Once you register for the exam, you'll be escorted to your exam track. There'll be numbers on the station doors throughout the exam track that will help you navigate through the stations. Each OSCE station is timed, so they'll give you a signal when to enter and when to leave the station. There'll be several candidates in your exam track, so all of you will rotate through all the stations in the order that is assigned to you. Each candidate is pre-assigned to start at a specific station. For example, if there are 10 stations, you'll start at station number 1 and rotate through to number 10. There might be wait stations to accommodate for the number of candidates in your track. For instance, if there are 10 stations, but 11 participants in the track, one of the participants will sit at the wait station for the duration of one station before moving on to a real station. Each station is unique. The equipment, setting, and standardized patients, or SPs, will vary based on the purpose of the station. Remember, each station will have a copy of its own instructions inside for reference. There's no penalty for reviewing the instructions. If the station requires materials such as a growth chart, lab results, or other relevant information, they'll be available in the station and sometimes outside the station as well. However, some stations' props will only be available upon request or if you indicate the need for them, such as information about a patient's vital signs. At each station, a physician examiner or PE will be observing, assessing, and recording your performance while you interact with the SP. The OSCE is not an interview, so you do not need to introduce yourself to the PE. While you can't completely ignore the PE's presence in the station, you should not pay attention to the PE's facial expressions or scorekeeping. Try to focus your attention on the patient. However, you will need to interact with the PE in some cases, such as the following. Confirming your ID number as you enter the station. Your ID will be written on your booklet. If you misinterpret the task in the instructions, the PE may say something to redirect you. In stations where you're asked to verbalize your physical examination maneuvers, the PE may provide the result of your physical examination maneuver as if you had completed it. And if no information is provided, just move on. Once you finish going through all the OSCE stations, you'll return your exam notebook with all the pages intact and your candidate badge. Once you are released from the exam, you'll be signed out of the examination center, given your personal belongings, and escorted outside. You'll begin each station in front of the station door where you can read instructions for that station. Go over them carefully and wait for the signal to enter the station. The instructions located on the door of each station will also be present inside the station, and you can reference them at any point without penalty. Once you enter each station, you must present your candidate code to the examiner in the room. The stations are designed to assess these 7 competencies: history taking, diagnosis, data intervention, investigations, management, communication skills, physical examination, assessed in a modified format, procedural skills. Procedural skills typically come up in medical school or program-specific OSCEs rather than in examinations like MCCQE Part 1 or 2. This involves tasks such as inserting an IV, a catheter, or a nasogastric tube on a plastic model and not a standardized patient. The types of tasks you'll face in each station will vary. They may include, but are not limited to, the following: taking a patient history, conducting a focused examination, taking a history, and doing a focused examination, a combined task, managing/resolving a patient problem, assessing and managing an urgent or emergent situation, counseling a patient and or family members, answering oral or written questions, short answer written in or multiple choice, summarizing and presenting findings to an examiner or colleague, reading or referencing materials related to the patient's situation, such as articles, charts, test results, medication lists, and summaries, interacting with physicians or other healthcare professionals. Be aware that some OSCEs include paired stations. This type of station requires you to perform 2 components sequentially in 2 separate rooms. Both components will relate to the same clinical scenario. For example, you may be asked to review a patient's chart in the first component before meeting with the patient in the second component. Or you may meet with a patient in the first component and then answer written questions relating to that patient in the second component. The SPs you'll examine will either be healthy persons or persons with chronic stable findings. They've been trained to present a real patient's signs and/or symptoms reliably and consistently. You should interact with SPs as you would with your own patients. In cases where there is a physical examination component, you'll be expected to voice rather than perform what you would do to the patient. You'll be asked to verbalize to the PE what physical examination maneuvers you would perform and what you would be looking for. The PE will verbally provide the results. Interacting with the SPs also include questioning them and responding to their problems. Your interaction with the SP is part of what the PE is assessing. It's important to know that it's not enough to prepare for the OSCE using books and other content materials. Additionally, the AAMC and the Medical Council of Canada, MCC, do not endorse any specific reference books about the OSCE stations. Materials that may be helpful should touch on the key principles of doctor-patient interaction, as well as address common ethical and legal issues of the medical profession. They should also be based on a focused approach to presenting problems. When you are looking for study materials, keep in mind that some references may use examples of cases or scoring instruments that are not representative of those used in examination you're preparing for. For your reference though, the Medical Council of Canada has created a list of reference materials that its test committees have used to validate examination questions and content. You may access this list on our blog, but remember that the OSCE tests your skills and abilities, so simply reading reference materials is not going to be a sufficient preparation tactic. You should also know that there are no approved preparatory courses available for candidates getting ready for the OSCE. Some medical facilities offer programs that may be helpful, There may also be commercial preparatory courses available near you. However, the usefulness of these courses has been debated. While these prep courses give you an opportunity to become familiar with the OSCE format, most of them emphasize the examination taking skills rather than your clinical knowledge and judgment. So if you have weaknesses in your clinical competence, these types of courses are unlikely to help you. Like with most examinations, your first step should be assessing your baseline. For OSCE, start identifying the objectives that you need to review. Examine what you need to study and focus on common critical patient presentations. Make sure you're honest in assessing your knowledge and preparedness. When you're going over the objectives, create differential diagnoses and identify key features that will lead you to establish or confirm your differential diagnosis. Create checklists and identify key orders for investigation and management plans for each one. Write this information in a notebook or a Word file on your computer so you can access it anytime. If you realize that there's a knowledge gap in a particular area, go back to the basics. And remember that your study plan must include a detailed outline of the content you'll cover and active review strategies. Recall how you organized your study schedule for other exams, such as your MCAT study schedule, and make sure that you stick to it as much as possible. Memorize the steps of medical maneuvers. It's important to know each step of a medical procedure or a maneuver that you may be asked to perform in an OSCE. As you study, if you run into a patient problem and you're uncertain about the specific steps you need to accomplish the task before you, research the specific sequence of actions you need to successfully complete the task. Once you write them down in your notes, you will need to practice the sequence until it is drilled into your memory. Once you habituate yourself to follow the correct action sequence when dealing with a specific problem, you'll perform the task instinctively. And to get good at this, you'll need to practice with a group of friends and colleagues. The most effective study strategy is the practical application of your clinical skills and knowledge. To do this, you should form a study group. Start by identifying which objectives are the most important for each group member to review, such as management of chest pain, assessment of vomiting in a child, etc. And make sure that the most competent members of the group do not take on all the responsibility. Every member of the group needs to be challenged, so make sure everyone gets a fair share of studying and practice. Once everyone discloses the objectives that they find most challenging, you can create a presentation schedule. A member of the group who is confident in a particular objective can create a presentation about this objective. Each member can present common patient situations that they understand well. As each person presents their patient problems to the group, they should quiz individuals within the group about how they would assess and manage these problems. Be critical and make sure to challenge each other. Ask questions like, what other diagnosis would you think about in this situation? How would you differentiate between them? What should you assess on your physical examination? What else should you assess? Now, let's go over some key exam taking strategies that will help you ace your OSCE. Remember, the OSCE will provide you with one important item that will help you navigate through the stations: your notebook. When you register for the exam, your candidate identification code will be printed on the booklet. You will need to verbally confirm your identification code with the PE upon entering each station. Most importantly, you can use the booklet to jot down information before and during your stations. Use the notebook when you're reading the instructions. As you're reading the task and the patient information, note down the details before you enter the room. You can also note down any questions that come to your mind or any other reflections you have about the patient description. Note what you need to know or do. Don't forget, the instructions are also available inside the station if you want to check the patient information again. While you're practicing for the exam, don't forget to have backup strategies in case you find yourself lost about a patient problem. Try falling back on basic clinical interviewing and physical examination skills. Do your best to find out everything you can about the patient's problem. It is a timed exam, but don't be afraid to take a moment to think about what you want to do next. You must be careful to read, listen to, and follow instructions from the site staff. Make sure to take a mental note of the signal system, the track layout, and other details present in the track stations. Most importantly, read and follow the instructions provided outside each station. Don't be tempted to do more than what the station instructions indicate. For example, if the instructions say take a focus history, then do exactly that. Do not complete a full patient interview covering issues that may not be relevant. Before you enter a station, do not make any assumptions about the purpose of the station. For example, you may rush into thinking a station is designed to assess something, but remind yourself to keep an open mind. And remember, the OSCE is designed to assess your active clinical skills, so it's important to be guided by the patient's responses. You should carefully listen to whatever information the patient tells you. These should be regarded as instructions, as they too will guide whatever you do in the station. Quality communication with the patient is a key component of your performance. The examiners will assess you not only on what you say and ask, but on how well you communicate with the patient. For example, avoid listing off a series of close-ended questions to show off your expertise or because you think it will be on the checklist. Such interrogation will not score highly in the global assessment, which looks at your organization, attitude, and genuine connection with the patient. Instead, demonstrate your ability to apply appropriate questioning approaches, both open and closed questions, as well as other communication skills. Additionally, don't forget to introduce yourself professionally to the SP, just as you would when you walk into a real patient encounter. A professional and courteous introduction will create a welcoming atmosphere. Remember, a good physician must be a good communicator. Demonstrate your empathic and attentive patient approach in the OSCE. Keep track of time. The OSCE stations are usually only part of what would be a realistic physician-patient encounter, so time management is vital. You will be given a warning signal before the end of each station, but you should keep track of time while you're present in the station. Be especially careful in stations that ask you to perform 2 tasks, as you would need to divide the allotted time to complete both tasks. For example, if a station instructs you to do a focused history and verbalize your physical examination maneuvers, you must divide your time accordingly. Remember, if you're having trouble staying within the allotted time slots as you practice, the problem may lie in your patient assessment approach. Each station will give you enough time to complete each task. The tasks have been reviewed by many physicians and deemed appropriate. Don't forget that all candidates face the same challenge. Even if the time limit is challenging, most candidates finish most stations well within the limit. When you practice for the test, make sure your physical examinations are not too generic and thorough relative to the patient problem you're practicing with. Remember not to ask many questions in a disorderly manner. Avoid asking too many close-ended questions, making the patient move around, explaining too much, and missing verbal and physical cues from the patient. You might want to try different assessment approaches to find the correct one. Your patient assessment should be based on the presented clinical problem and its possible causes. Here are some OSCE don'ts. Do not pay attention to the examiner's pencil. There are different checklists, and some can only be completed after you leave the station. How often the examiner writes on the checklist during your station is not a reliable indicator of your performance. Concentrate on the patient and do not let the checklists worry you. Make sure you read the task as well as the patient's problem. The instructions will give you a clear task, so make sure you follow it. For example, if you're asked to conduct a focus history, then you will only get scored for taking a history in a clinically appropriate manner. You will not get credit for counseling the patient if the assigned task is to take a history. You will only get credit for the assigned task. Sometimes, candidates approach a station by trying to figure out what is on the test, rather than basing their actions on a clinically appropriate approach to the patient problem. For example, the patient information describes a belly pain problem, and you are asked to verbalize a focused physical examination. Even if a complete basic abdominal exam is verbalized, it's generally not sufficient to achieve a good rating on the station. You may have verbalized some maneuvers that were irrelevant to identifying the most likely diagnosis. The emphasis in a focused physical examination should be making a diagnosis and ruling out differential diagnoses. So although an abdominal examination is important, but based on the patient information given to you and whatever findings or lack of findings you discover, there are other maneuvers and/or systems you will need to assess to rule in or rule out your differential diagnosis. Do not bombard the patient with as many questions as you can, especially if you're including them in the hopes of asking enough questions for the PE's checklist. Your approach must be coordinated and succinct, preferably organized around a differential diagnosis or around generating a differential diagnosis. Your OSCE is not the time to show off your theoretical knowledge. You are expected to speak to the patient in a language that he or she will understand, not to quote textbooks to the examiner. Your manner tells both the patient and the examiner a lot about your attitude to the patient. You do not need to do it all with words, so avoid lecturing and showing off. SPs often report that OSCE candidates do not listen to them and therefore miss vital information. If a patient's answer is not clear and the issue is important, then explore it further. For example, you ask the patient if he or she has ever had this problem before, and the patient responds with, "Not like this." You may want to know what was meant by this statement. If you appear indifferent to their concerns, the patients are expected to react accordingly. You will get less information from them. They are not required to give everyone their whole story. You are expected to elicit their story. And as in clinical practice, patients will be reluctant to confide their underlying fears or embarrassing information if they feel like you're indifferent, judgmental, or hostile to them. And remember, even though this is an exam, you are expected to act the way you would with real patients. The quality of your patient interactions will have a huge effect on how you score in the exam. Be aware that you cannot receive credit for physical examination maneuvers that you would perform unless you indicate to the examiner that you would do such an exam and what findings you would be looking for. In most cases, the examiner is given findings to report to you, but he or she can only do so after you state which examination you would do and what you would be looking for. If you remember from the station descriptions I had outlined, in some stations, you are expected to provide the patient with information or advice relevant to his or her problem. Some candidates seem to miss the purpose of these stations and only offer very general statements like, "There are risks associated with X and you should really do Y." If you're tasked to advise a patient, you're expected to provide him or her with the quality of information that reflects your abilities as a physician, assisting the patient's informed decision-making and going beyond what is available in the public domain. This wraps up our video for today. Check out our blog to learn more about the objective structured clinical examinations and how to prepare for your examination. The blog also covers frequently asked questions about the OSCE. I've included a link in the description of this video so you can find the blog easily. If you would like us to help you prepare effectively for your OSCE, click on the link either above or below this video to schedule your free initial consultation. Hopefully you enjoyed this video, so please subscribe, like, and leave a comment. If you have any questions about the OSCEs that I didn't cover in this video, let me know in the comments section and I will get back to you as soon as possible. Thanks so much for watching this video, and see you next time.